Hello, Zero Advocates. Welcome to the State of Prostate Cancer Policy, Insights from Washington, D.C. and Your Backyard. I'm Ali Manson, Vice President of Government Relations and Advocacy for Zero. I'm joined by my colleague, Susan Sweat from Cornerstone Government Affairs. Susan, sorry, I should have given her a warning there.
Hey, everybody. Sorry, I had to get off mute. Good to talk to you and give you this update today.
Thanks. We are your tour guides for today, and we're going to catch you up on what has happened in Washington, D.C. since the Zero Summit back in February. Seems like a lifetime ago. And then we'll be joined a little later by our colleague, Georgia Bates, who is Zero's Manager of State Government Affairs, State Government Relations. And she will talk to you about what's been happening in state capitals throughout the spring, as well as what to expect from the rest of the 2024 legislative sessions. So if we could go on to the next slide, we will jump right in. I'm excited to see so many of you in our audience today. And just to recap, we had our 2024 summit at the end of February. We had 129 advocates, 144 meetings. You all represented 36 states, and almost 40% of you are first timers, which is fantastic, right? Every time a new person comes, an angel gets its wings. Every time a new person comes, we grow our community a little bit, and we get to make our voices bigger and louder, and we get to ask for more. So thank you to everyone who joined us. And I know many of you are on this webinar today, so it's always a pleasure to see you. Next slide, please. We'll give a quick recap. I think everybody remembers, right, Susan, the Prostate Cancer Research Program has been our top priority for a long time, right? It's actually the reason Zero exists. And it was the thing that, folks got to go in and ask for that $120 million. And in all 144 of those meetings, asked for those $120 million, and asked people to sign on to the Dear Colleague letters. I'm not comparing the list of meetings to the list of signers here, but 144 meetings, 137 signers on the House letter. There's some overlap.
One of the things, Ali, that I'm really excited about this year was we had this very messed up process. You might have recalled, if you were one of the 60% that have come before, usually the letter opens up for signatures either the week that we're having the summit or like the very next week. In this case, we waited months before the letter opened up for signatures, and then it was open for a very truncated period of time. I think we only had 2 or 3 weeks in the House and less than a week in the Senate. And to get those numbers on this letters this year, I was so proud. It read that we had done a really good job of educating during our meetings at the summit, during those 144 meetings, and that you guys then helped us. You pitched in when the letter opened and did that follow-up necessary to get those members to sign on in very short order, very quick fashion. I was thrilled with these numbers, given the machinations of what we were working with a very messed up process this year at approach. So thank you guys. This is incredibly impressive.
Well, I think the Senate letter was actually only open for like 3 days, and we picked up almost everyone who was on last year, except for the Senator Feinstein, who died, so didn't sign the letter, and maybe one other. So it was all because of those meetings and those almost 3,000 emails y'all sent. That's a lot of emails, in case you're wondering.
Very, very impressive. So what have we gotten from that? Well, just today, actually last night, we saw the House Appropriations report, which includes our funding. It was released last night. We are at the $110 million level again. That's a little frustrating and disappointing. We went in and did a meeting a few weeks ago with the committee staff, and they said, hey, we want you to know that if you're level, then you should throw a party, because the number that we're working with in the bill this year is so much lower that we are really looking hard at different places to cut. So we came out with level funding. There were no programs that got increases in the defense health space. And so while I know that we wanted that 120 Given all things considered, given the way the process worked out this year, the numbers that they're working under, the caps that they're working under to fund, we are really, really excited we were able to stay at that level and not see any decreases. That's the House side. On the Senate, their process is a little bit slower. We will not see those bills probably until July or maybe even September. The Senate usually comes in lower than the House, so the House is usually carrying the higher number. And we don't expect this process to be finished until after the election in the lame duck session of Congress. We'll see a final bill, hopefully right before Christmas.
And remember, that means that it will be already into the new fiscal year, right? For those who aren't paying attention, the federal fiscal year runs from October 1st to September 30th. I wanted to say 31st. There is no September 31st. But they are, of the last couple of decades, almost always behind schedule. So we are not surprised. And, we go into these meetings with committee staff and we say, yes, if we get level funding, we will be grateful. But also remember, we won't actually be happy, right? We're, I think as Courtney Bugler, our CEO, says all the time, we are proud but dissatisfied because we would never want them to think that level funding is good enough, but also we are operating in reality. We do recognize that we don't live in a dream world as much as we'd like to. So we will keep all posted as these numbers progress. But again, like Susan said, don't expect to see final numbers until, well into the very end of the year and after what will probably be a crazy couple of months between now and the election. We can go to the next slide, please. All right, the PSA for Him Act. This was our really big, exciting one this year. We were fortunate to see, not only did we get a Senate bill for the first time, which is now up to 6 sponsors. We also have 82 co-sponsors in the House, and many of those signed on in those couple of weeks right after the summit. So that's a nice way to kind of measure our impact. We can see a direct relationship between the meetings you have and the sign on of people to that bill. But Susan, what's happening now?
So right now, we've got the bill. We keep creeping up those co-sponsor numbers. We're slow and steady on getting those numbers up. We're really excited about that and grateful for you guys for bringing that up in your meetings. I know that we're doing some follow-up meetings right now, and we're specifically targeting House Energy and Commerce Committee Republican members. They are in control of the Energy and Commerce Committee and set the schedule for what's going to come up. In that committee, Dr. Larry Bouchon, our sponsor for the legislation from Indiana, has been pushing the leadership of the committee to schedule a legislative hearing. We need a legislative hearing, and then we go to a markup at the committee level before things roll on to the House floor. So we are pushing to get that legislative hearing this summer so that we can have that bill through most of the process and eligible to be picked up for movement at the end of the year. So if you happen to know that your member of Congress is on the Energy and Commerce Committee and a Republican and isn't signed on to this legislation yet, we want to talk to you. We want to help arm you to really engage them and push them a little bit more to help get this on the calendar for the committee.
And we're happy to help you set up a meeting if that's the case. Susan, I'm just going to play devil's advocate here and say this is a hard time, right? We've got an election, we've got things happening. Tell our listeners a little bit about what a path forward looks like. Are there bills that must move? Are there opportunities? How? Give it to me at my 8-year-old's level, right? How would we move this forward?
Sure. So legislation gets introduced at the beginning of a Congress. A Congress is every 2 years. And through those 2 years, the committees are kind of chipping away at what gets put on their plate to consider with a hearing and then to move through markup. And they have lists kind of going in the background. These are unofficial lists, but they have lists of things that are pretty non-controversial that we think we could move. They have lists of things that are have been waiting a while, and the members are getting really pushy about seeing movement on their legislation. They have like items that they could mesh together into a larger bill. And then, they're assessing each one of those bills, right? Is this legislation something that is non-controversial? It's going to be easy to get it through without taking up a lot of floor time and amendments and those kinds of things. Does this bill have a companion on the Senate so that we can, what we don't want to do if we're committee staff in the House or the Senate is waste a lot of time on a bill that's going to be dead on arrival when it gets to the other chamber. That's one of the reasons we're so excited that we have a Senate companion this year. It means we are not dead on arrival. We are a candidate for consideration. The Energy and Commerce Committee will probably put together a few different packages of legislation that fits into some of those categories. Non-controversial, the other chamber wants it to, pushy member of the committee that's well respected trying to get it done. And they will pass those things through the committee. They may or may not take them to the floor for votes. They might just lump them all together and pass them through the floor with an easy up or down vote towards the end of the year. So they are planning their long game to put together packages after the election to kind of clear the deck of everything that they have on their plate that would be easy to move or has a special interest from the members of the majority of their committee. So we are definitely in that mix, in that category. We're in the conversation and we're trying to get on the train.
And we will have updates for you as they come along, right? We send regular emails. When there are opportunities for you to stick your finger on the scale, we will send you an email and let you know how to do that. This is going to be something that hopefully folks will all be able to move quickly when opportunities arise, right? That's where we want to be ready and waiting. Let me go to the next slide. Okay, related to the PSA Screening for Him Act, I just want to mention the United States Preventive Services Task Force, everybody's favorite. Susan's going to use the word basement dwelling. It'll be fun. But so the way the task force works, right? The reason that we have the PSA Screening for Him Act is because the USPSTF sets recommendations for clinical preventive services, right? They give them an A, B, C, D, or I grade, I being insufficient information. And if it's an A or B grade, then those services are on the list that insurance companies are required to cover without cost sharing. Right now, the USPSTF's recommendation around prostate cancer screening is a C, which means it is not required to be covered without cost sharing. That is why the PSA Screening for Him Act goes ahead and just modifies that part of the US code to say, in addition to A and B rated services, also prostate cancer screening for men at high risk. But the USPSTF has to update their recommendations regularly. Hypothetically, it's at least every 5 years. I think that in reality, the average is more like 8, 6, 7, 8, somewhere in that range. Because in fact, it takes a lot of time and money to do this. So to their credit, they are working hard to do new recommendations for all of the recommendations all the time. And it's a slow process, but that is our opportunity to go in and attempt to influence their work. So they decide to develop a new recommendation or update an existing one. They release a draft research plan that says that this is how we're going to approach this question and what kinds of questions we're going to answer, what kind of studies we're willing to consider, things like that. There's a comment period. There's a final research plan. There's a draft recommendation, right? They take that research plan, they do everything in the plan, and then they put out a draft recommendation that then still has an opportunity for public comment. And then they produce the final recommendation. And the whole process is repeated again, roughly 5 years later. We can have a whole other webinar about the challenges in that process and where there's not enough sunlight and not enough opportunity for true public comment and to kind of understand who's influencing the task force and who's on the task force and all that stuff. But the fact is right now we are in the middle of a prostate cancer screening recommendation update. The draft research plan came out last fall. Zero did submit comments. We had some opinions about how they were framing their questions. They released a final research plan back in January. And now we are in the process where we are waiting for them to have that draft recommendation, at which point we will surely offer more comments before they have a final recommendation. But we are kind of smack dab in the middle of the process. We are setting up meetings with the USPSTF to offer them some input and hopefully the opportunity to have that draft recommendation look good and be really reflective of the science and the real world evidence that we know supports prostate cancer screening. And by the time the draft recommendation comes out, we'll know if they listened. And then we'll probably have more meetings if we're honest about it. But this is not the same as the PSA Screening for Him Act, but it is a related piece that interacts with it. And until we kind of know how this finishes, it may influence future decisions about PSA for him. I don't expect to see a draft recommendation before late fall at the earliest. Realistically, these take a long time. So we still have this Congress, we still have the PSA Screening for Him Act, we're moving forward, but just know that this is happening in the background and we are engaged on the process. It's fun, isn't it, Susan?
Never a dull moment with the USPSTF. We continue to educate members of Congress about the USPSTF. I think there's a very sympathetic view on the Hill about the trouble that they cause some very obvious cancer screenings like ours and breast cancer. But we do get questions when we go in and we talk about the PSA for Him Act. Well, why don't we fix USPSTF? We're like, fix us first, right? Just fix our problem, and you can come back and reform the government whenever you'd like. But I think there tends to be some interest in reforming them. And that's not something we're opposed to, but we're going to keep our eye on the prize and hopefully get a little bit better in these recommendations. We've noticed these last few times we've inched up just a little bit, and hope that we can, I don't think we're under any illusion that we're going to get above a C, but if we do, I think that's going to be a very big accomplishment. And that is our goal, to keep working hard at it.
But it'll take a while, right? The truth is they don't give an official timeline. They don't make predictions of that kind. I'm hopeful that when we meet with them, we'll get to ask that question and probably again be given a not determinate answer. But my guess is probably late in the fall, but that's just a guess.
Yeah, I would be surprised if we get this. It's not going to be done this summer. That would be shocking. I would think it gets done this year, but it could be into the first quarter of next year. Like that would not be unusual.
It would be unusual.
Yeah.
Yeah. All right. How can we go on to the next slide, please? And actually, if folks are interested in more background on the USPSTF, we do have a longer video explainer on this on our Advocate Education Hub that I think we can drop into the chat. We can drop that link into the chat if anyone really wants to go back and watch a 20-minute video talking about why the USPSTF doesn't support prostate cancer screening in the way that it should. But let's go on to the next slide, please. Thanks, Hal. And I am going to invite my colleague, Georgia Bates, who is our not quite brand new anymore, but 4 months into her career at Zero, manager of state government relations and advocacy. I'll just go ahead and caveat that Georgia's only been with us for 4 months, but as you'll see here, she has done a lot in that time. So Georgia, tell us a little bit about the state bills, which are kind of analogous to PSA for him at the federal level.
Hello, everyone. My name is Georgia Bates, as Ali said. Excited to meet you if I have not yet already reached out to you. Just a bit about me before we get started. I'm based in Austin, Texas. Previously lobbied for the Leukemia and Lymphoma Society. Last session in Texas, I helped defeat bills that would have weakened prostate cancer screening protection. So this is my bread and butter as, someone whose family has been impacted by prostate cancer. It's an issue close to my heart, and I've just been thrilled to see these bills moving through even in my short time at Zero. So I'm going to just dive into it. This is a timeline of what has happened. The bills in dark blue are bills that have already been passed. And right before I was onboarded, Oregon passed an administrative ruling that wasn't a bill, but was a good development for prostate cancer patients in Oregon. Then bills in Kentucky and Tennessee were passed. I'll go a bit more into depth about all of these bills in a moment, but just going over the timeline here. And there are bills in Delaware, New Jersey, DC, and Ohio that are moving. And then we are planning for bills in Georgia, Texas, and Virginia next year. I will say that this year it's been a running start for me, and we've been chasing opportunities instead of creating opportunities and building our numbers and being strategic about how we approach advocacy. But fortunately, things have just been moving on through, and we've been able to support and move and push these bills through. But I'm super excited to get to know all of y'all and get organized so we can have boots on the ground for 2025. So next slide, please. So I'm not going to go into depth about the bills that were passed prior to 2024, but if you have any questions, feel free to reach out. This presentation, all of these bills are hyperlinked if you want to go look more in depth into the text. And if you have any questions about any of them, please feel free to reach out to me. My email is georgia@zerocancer.org. But speaking of Oregon, it was a health agency ruling where under 50 high-risk men with a family history, African-American or African ancestry, and other risk factors determined by a physician, and also men 50 and up have their PSA and DRE covered at no cost for insured patients. So the Kentucky bill was a multi-cancer bill that was authored by a Republican, and a bunch of Democratic co-sponsors hopped on. And fortunately, it was passed pretty quickly back in April, and Zero submitted testimony. We had a phone to action campaign to support the bill. And then we also helped push the Senate vote. So the bill covers lung, breast, cervical, prostate, and colorectal cancers. Since Kentucky is a high incidence state, a lot of the cancer community came together to push that bill forward. So it was a really meaningful first bill to add to our list. And it was also the first state that had a mixed government, both Republicans and Democrats in charge. It's called the Purple State. But moving on to Tennessee, which is our first red no-cost PSA state. This bill, it was a combined effort with a lot of our partners and two advocates that were really involved, Dr. Kelvin Moses and Chris Duvall, who submitted testimony. This bill got derailed a little bit by opposition efforts, unfortunately, but we were able to negotiate amendment language that removed the bad language that they were trying to pass that would have weakened screening coverage protections. So good news on that, and great to have friends who go to bat for you and your cause. So besides that amendment negotiation, we also sent coalition letters to House leadership explaining the amendment changes, and also a coalition letter to the governor just to make sure he knows that he should sign that bill. And he did on May 21st. So great win for no-cost PSA bills in the states. And go to the next slide, Hal. We'll talk about the bills that are still moving. So just to preface all of this by saying, Ali, when she onboarded me, she said, we'll throw a party if we pass one of these bills. And we've been lucky enough to pass several of these bills. And I really didn't think I'd be busy this summer, but I am, because some of these legislatures are still in session. So Delaware, we're waiting on a vote this month in the Senate. It's already been voted and passed out of the House. So it's the last vote the Assembly needs to make before the bill goes to the governor's desk. And what we've done is we've submitted testimony both in the House and the Senate. Shout out to Gary Pippin, who submitted live testimony. It was really impactful, speaking as a survivor to the committee in the House. But we have a coalition letter to the governor that 17 of our partners have signed on to. And we're just waiting to see when the Delaware Assembly, the Senate, will hear and vote for the bill. and we'll keep you updated on that bill. But in New Jersey, we initially thought that this bill would be heard after the election because they gavel out at the end of June and reconvene after the election. But we've heard from the committee that will be hearing the bill that a hearing will happen soon. So we're anticipating it to happen in the next few months. And right now we're trying to find those in the Newark area that would be interested in testifying, or any people in New Jersey that would be interested in scheduling a meeting with your representatives to recruit support for this bill. If you have any more interest in getting involved in New Jersey, please reach out to me. I know I'll be reaching out to some of you in the New York area as soon as I get the hearing date for the Assembly Financial Institutions and Insurance Committee hearing. So moving on to the District of Columbia, we are waiting for a markup. Our hope is that it'll happen in the late summer. Unfortunately, our bill has got caught in the crossfire, so to speak, with a recall election on a local level. So the bill still has support from the vast majority, I think all of the DC Council. It's just a little hiccup in the process since they're in the middle of budget discussions. So moving on to Ohio, it's the most recent update. This bill was filed on the 21st and referred to House Insurance. They gavel out on the 26th and won't be reconvening until after the election. So our thought is it could get passed in the lame duck session after the election and this fall, but it could also be refiled for next session. But either way, we'd love for advocates in Ohio to get more involved so we can start growing our numbers, contacting our legislators, and growing support. It has support, a co-sponsor list in the House that's basically a quarter of the whole Ohio House. So we just need to grow our numbers with leadership. We need to reach out to them, and you'll be hearing a lot more from me about Ohio in the near future. So moving on. Next slide. So for 2025, I'll just pause before I touch this and say 2025 priorities and opportunities will depend on what happens in 2024. And since we have so many bills moving at the moment, this list might change. I will say Texas and Virginia are pretty certain that we will be organizing in there because we do have a bill, both bills will be refiling. So we're taking the baton from last session, moving it onward to the next session. But with Georgia, it will be a new bill. So there was a bill to require insurance to notify those covered of their coverage for prostate cancer screening. And we're going to try and target those bill authors to see if they have any interest in filing a no-cost PSA bill. To my knowledge, there hasn't been one bill filed, but I do know that Georgia has legislated recently on breast cancer and other cancer-related issues, but really hasn't done much in terms of prostate up until the insurance notification bill recently. But we have a great number of advocates in Georgia. As a person named Georgia myself, selfishly, I would love to go to Atlanta because I've never been, but looking to get, oh, yeah, thanks for dropping my email. Yeah, but looking to get the Atlanta crowd and advocates in Georgia more involved and more engaged. So if you have any questions about that, my email is just dropped in the chat. So please reach out. In Texas, we are working with ACS to schedule visits with targeted staff members and the Senate. The House has passed the bill twice. So we're focusing on the Senate to avoid a lot of the infighting that's happening between the House and the Senate at the moment. And we're hoping that early buy-in will help gain bipartisan consensus and support around this bill. Because at the end of the day, prostate cancer affects Democrats and Republicans alike. It affects us all, and we need to legislate on it. So excited to organize in my home state of Texas. I'm a few minutes away from the Capitol, so I know I'll be spending quite a bit of time there. If you're interested about getting involved more in Texas, please reach out. Moving on to Virginia, we are, this bill, HB 477, is a bill that was filed originally in 2022 and then was referred to this review committee called, I think it's the Health Insurance Review Committee. And it's a committee, there's multiple steps within the process, the review process, to evaluate the impact of adding a new benefit or a new provision of a benefit. And so because our bill is so narrow in that it's just eliminating cost sharing and not creating a new benefit, hopefully we expect to get through the committee fairly easily this fall. So we've been in contact with the Virginia Bureau of Insurance to get more information and are working with them to ensure that process is smooth, streamlined, and that we're in a position to refile the bill in 2025. So fingers crossed on that one. Fortunately for all of these bills, the financial analyses, the numbers are really, really good. And we want to, tell legislators that. So if you're looking to get more involved, if you're in a state that I've mentioned, please reach out and expect to hear from me if you haven't already. But I'm very excited to have a bit of time this summer to really get to know y'all better, be more strategic about how we spend our time, and assemble our boots on the ground. Well, with that, I'll hand it over back to Ali and Hal.
We have a handful of questions for Georgia, but I want to keep going really quickly because I think there'll be more questions that tie together after this next slide. So if we can move forward. Just to think about how you can get involved, right? Georgia popped her email in the chat. You can also always reach me at Ali, A-L-I, at zerocancer.org. We've got an action center on our website that lets you send emails, those 3,000 emails that went out supporting the PCRP. Sometimes you'll receive emails from me or from Georgia or from Hal. And all you have to do is click the buttons. You don't even have to go looking for anything. It's really quick. It's really easy. And it does just, it's a chance for you to add your voice to the larger group. And I think many of the folks listening in here do that regularly. And so thank you. I very, very much appreciate it. For many of you, texting is easier, or at least it's more top of mind. So if you text 0 to 52886, you can actually sign up to get those same emails via text. And the link comes in. Again, it's still really quick and easy. August will be here before you know it. You're encouraged to visit members in your district. That way you can build really the kinds of relationships that will really pay off for us long term, both at the federal level, but you can also, your state representatives and senators are there all the time. I guess it depends on how big your state is and how far away your capital is. But right, in a state like Delaware, you're always within spitting distance of your legislators. In Texas, they might be farther away at different times of year, but that relationship building is so crucial to how we have success. So I really encourage folks to look up your legislators, make a phone call, set up a meeting. I promise that they don't bite most of the time.
And Ali, I'll just add, since COVID, legislators have been much, much more open to virtual. So if you're in Texas, but you're in El Paso and you don't want to make the 8 hours, hop on Zoom and we'll talk to your legislator.
Right, there are so many options and we are happy to facilitate all the ways. If you see them on the airplane or at the grocery store, they're public figures, it's fair game. Be polite, but talk about prostate cancer. And then, as many of you have done, plan to attend the 2025 Zero Prostate Cancer Summit. It is already, I think the website is almost ready to go up. That will be live with registration any moment. And we will start pushing that out later this summer. But, plan now, right? Put it on the calendar today, February 23 to 25, 2025. But I want to kind of take this to say, Georgia, what kinds of opportunities do we have for people to get involved in the states? How does it work? Aside from, obviously, they can do a Zoom meeting, but what kinds of opportunities can you give them? Because I think you do have more opportunities more frequently than we do federally in some ways.
Yes. So it does depend on the state that you live in. I will say we are scaling up our amount of campaigns into basically bills that don't cover eliminating cost sharing, so education awareness bills, that sort of thing. So for those kinds of things, when I email you, I include a campaign link similar to what we have on the federal level, and it's just filling out the campaign. There are other times where I'll need to reach out to advocates that live in a legislative leaders district, like a speaker or a Senate president. And I will reach out to you if that's the case so that you can make that outreach. A lot of it does depend on where you live and what's going on in the state. But I will say that I will communicate those opportunities when you're eligible. And if you have the initiative and the drive to contact your legislator, please just keep me in the loop so I can give you all of the resources, support. I can help arrange the meeting. Anything you need, I will try and be there to resource you and support you as you reach out independently. But for coordinated asks, just keep your emails open. I may call you if it's really urgent, but you'll be hearing from me if we need you for something specific. But all of our campaigns and those large asks will come through your email. So just keep your inbox open.
And Susan, it's kind of the same but different federally, right? Our cycle's a little bit different, and our kind of the timing of things. We tend to be very heavy in the spring. So it's got some similarities, but why don't you just give a quick chat?
Sure. I can guarantee you that next January through May, we're going to be very busy. We're going to have a new Congress. Bills have to get reintroduced. We still have the PC Care Act that's out there as one of our summit priorities that will probably be focused on next spring. And then the summit will be here. And that's when the appropriation cycle and the opportunity for us to weigh into that appropriation cycle exists. It's all in the springtime. As we move into the summer, it tapers off. This year, an election year especially, we get to August and we'll be in drought season then. There will be the Congress will not be in session here in DC in August or in October. Now that does give us plenty of opportunities for you guys to do meetings back at home in your district with members, and we would love to help facilitate that for you. So you can, when that member of Congress that represents you is in your town or in the next town over, we could help you set up meetings to visit with them in August or October this year. But generally, our most active cycle of engagement is in the first 5 or 6 months of the year.
Thanks, Susan. And I want to invite people to ask questions. So use the Q&A function in the webinar. Go ahead and start plugging them in. But I want to take my prerogative to ask kind of a level setting question. We have the PSA Screening for Him Act. We have these state bills. They're kind of the same. Why do we have to do both?
Yeah, so until 2011, most insurance is regulated at the state level. We have a few exceptions where there's some employer plans and then things like Medicare, the VA, and TRICARE for active duty service members are regulated and created up at the federal level. But in general, insurance has been a domain of the states. And so the states usually have the most control, and you have a lot of differing requirements for what's included in an insurance plan. The Affordable Care Act in 2011 created national exchanges and set requirements for those national exchanges. And that's what, of course, we are talking about when we look at the PSA for Him Act. But the United States has a patchwork of insurance regulations and laws in this country, and we are kind of systematically going through and attacking each one.
And the other upside here, right, Susan, if we go in to Louisiana, for example, or Texas, let's go to the Texas member's office and can say, oh, well, your state also already passed this at the state level. So wouldn't it be great if everyone got to enjoy the same benefits that Texans
We absolutely get a lot of traction with those members who know that they're just doing something that their state has already decided was a good idea. It gives them huge top cover. It's also we can go in and kind of shame some members, especially, when Georgia's working on her stuff across the states, if the neighbor to the east and the neighbor to the west, if those states just passed it, what are you guys doing here? And so really we look for a lot of different, because we have a patchwork of regulations, it also means we have a patchwork of ways to triangulate our policymakers into doing the right thing. And so absolutely, so those of you that were on the Hill this year with us, you might have gotten a question about how much the PSA for Him Act cost. And one of the great things, because we've had a Maryland bill moving through, they did a budget assessment on how much that bill would cost in Maryland, which was very similar to what we're doing with PSA for Him. And it's a de minimis cost. And we're able to kind of take those lessons learned and those little bits of information from the states, apply them federally to help bolster our case. And then, vice versa. When we see movement at the federal level, that's going to just arm Georgia even more to go in and work her way across the country on all the little state regulations.
Susan, and I've got questions here about specific states, but are we looking at North Carolina? Are we looking at Florida? But maybe actually the better question for you right now, Georgia, is how do we decide what states are next?
Oh, that's a great question. I've pulled up a dashboard of so many different metrics, whether that's metrics about incidents, mortality, whether that's how many veterans there are in state, how many advocates we have in state, information about session length. All of these factors influence and impact how far a bill could potentially go. And so when I was onboarded, that was my first big project, is to come up with that dashboard and really zero in on where the opportunities laid. And incidentally, I highlighted Delaware and I think Kentucky. And by that time, we really didn't know that those bills were going to be filed, but because we looked at the data about what population has the highest need, what's the longest session where we have the most time to pass a bill, those kinds of things, those indicators clued us into where the opportunities may lay. That all being said, there is a part where an advocate and one advocate's initiative could lead the charge. I know somebody said something about North Carolina. I believe it was Michael. You have a Republican legislator in North Carolina who's your representative, and you should reach out to her. I think her name's Representative Cotham. We need to be reaching out to our people ahead of time to temperature check, really, because I'm not in state. Unfortunately, I know North Carolina is beautiful, but I'm not there. And so the people on the ground need to be collecting intel and giving it to us so we can further assess where the opportunities really lie. So great question about Florida and North Carolina. I will say with Florida, there's no coverage mandate for prostate cancer screening, but we've seen states like Kentucky and now Ohio, who doesn't have a coverage mandate in their state law, that are passing both coverage mandates and no cost sharing as a part of the coverage mandate. So it's possible. And it's definitely a higher probability if we have advocates like y'all that are on these calls, that are getting engaged, that are reaching out to their legislators and making it happen. So thank you for the questions. I would love to visit North Carolina and Florida selfishly, but we have limited bandwidth, unfortunately. So we will have, more dialogue on that if y'all would like, but reach out to your legislators if you'd like that to happen.
It's really the confluence, right, between need and opportunity. And any one of you can help to create that opportunity. So, Susie, I know you can. I know you can create the opportunity. Georgia, you kind of briefly mentioned this, but I just wanted to go back to it. We do mostly the no cost sharing bills, right? That's what we're really in the driver's seat. But there have been a couple of other issues and bills and opportunities in a couple of states. Maryland comes to mind, Georgia comes to mind, that are perhaps worth mentioning here that we've also worked on and lent our support to. That'll be good for prostate cancer patients.
Yeah, sure. I'll get into that. So the Maryland bill was a public education campaign bill on prostate, lung, and breast cancer prevention. We had Eric Morrow testify in support of the bill, and it was signed by the governor on April 12th. What's cool about the bill is that it requires the Maryland Department of Health to collaborate with nonprofits that focus on prostate cancer, which Zero is one. So we're eligible to collaborate on this campaign. And we think it's a great idea to follow up a no cost sharing bill with an education campaign to really get the word out about the removal of out-of-pocket costs for prostate cancer screening. So great win. It'll be a model for us as we look to other states to pass education and awareness program bills. And you'll hear more from me on campaigns and opportunities to get involved in the education awareness space in the state. She also mentioned Georgia. That's the annual notification bill I mentioned. And then also there's a few biomarker related bills to eliminate cost sharing for biomarker testing that we're supporting alongside ACS, who's really leading that charge. And then there was another bill related to social determinants of health screenings. So it would mandate insurance to screen for various factors, socioeconomic, housing, nutritional needs, that sort of thing, that affect health outcomes. That's really valuable data for providers to have to inform care and streamline processes, that sort of thing. So we wrote a letter of testimony in support of that bill, and that's a California bill that continues to move. I believe it's now in the Senate. It started in the Assembly. So still moving through the legislature, hopefully will pass. I think that's it for bills we've supported that are not no cost sharing PSA bills, but in 2025, we're really going to expand our portfolio of bills we're actively supporting, whether it's education awareness bills, patient navigation bills, health equity, veterans related issues, and also defeating bad bills that would reverse all of the work we're currently doing on coverage protections for screening and cancer related treatment.
I think everyone here heard Courtney at the summit say we're going to be bigger and we're going to be louder. And so I think you can expect that as we move into the rest of 2024, but really into 2025, Zero at the federal and state levels will be looking around more broadly to say what is valuable for prostate cancer patients, for their loved ones, for those who aren't yet prostate cancer patients, but might be, right? To make sure that we are taking, we're using all of our resources and we're getting bigger, we're getting louder. And we're doing more for patients. There's a last chance here for questions, and then I will ask Hal to pull up the next slide because I want to share some news with this group here first about a new opportunity. So starting in the 2025 summit, we will be launching the tentatively named, so please don't hold me to it, but the tentatively named Summit Leaders Program. So for the first time, Zero will be offering a program that lets people get a deeper advocacy and policy training curriculum over the course of a couple months leading up to the summit. It will be everything from the very basic versions of how a bill becomes a law, really basic prostate cancer science, right? Because I know that everyone here is an expert in their story, but that isn't necessarily the same as being able to kind of offer a general prostate cancer story or to kind of speak more loosely about what other people's experiences might be. There'll be some storytelling training. There will be really the opportunity to repeatedly and consistently workshop how you go into a meeting and talk about our priorities in a way that is moving and is motivating for policymakers. This program will be application only. It'll be a small cohort to start. Hopefully we'll be successful and we'll have tons of demand this year and we'll have to grow it in the future. But it will be an opportunity for these folks to gain the skills and knowledge necessary to be team leaders at the summit, right? So to really be able to lead a team from a large state, as well as to offer mentorship to other folks at the summit. And, hopefully also to take advantage of opportunities in their state, whether that is district visits with their federal lawmakers or it's engagement with their state legislators, because we will be arming you at a higher level. So please keep an eye out on your email. The Summit Leaders Program, final name pending, will be announced in the next couple of weeks. And we're really excited. I think it'll be a wonderful way to start deepening what Zero's advocates can bring to the table, right? To make everyone as armed as possible. With that, we will bring this to a close. 9 minutes before the hour, which means my dream of a 50-minute webinar is exactly almost on target here. And thank you so much to Susan and to Georgia for joining us today, and to all the folks in our audience who were kind enough to stick with us this whole time. Have a great afternoon.
Thanks, everyone.
Thanks, everybody.